Hi, I'm Monique Williams and I'm from Section 6, and I am getting ready to demonstrate how to hang a primary line. I already have a IV already inserted, so basically outside the patient's room, I've done my hand hygiene. The doctor, I'm going to check the orders. He ordered Rocephin for the patient. I have my medication card. He ordered 1 gram of the Rocephin, which is an antibiotic, and I'm going to check to make sure that this patient doesn't have any contraindications to the antibiotics, such as allergy to cephalosporin or penicillin, because this patient won't be able to tolerate it. And I'm also going to calculate how much medication and what my drops per minute are going to be. So I'm going to give the patient the medication in a 100 milliliter bag of solution, and he wants it to be infused over 30 minutes. And the drop factor is 10 drops per minute. So when I calculate that, it comes out to 33 drops per minute. So I have all of my information here, or all of my equipment, my tubing, I have my medication bag. I'm going to prep everything outside the patient's room and label it and get everything ready so that I'll be prepared once I walk in, okay? So the first thing that I'm going to do is I'm going to draw up my 2 milliliters of my Rocephin and put it into the medication, the IV bag that I'm going to hang. So this is my Rocephin, and it is within the expiration date, so it's not expired. I double checked that. I'm going to clean off the top of my medication. And I said that I'm going to draw up 2 milliliters. Okay, and then I have my bag of solution already, my 100 milliliters of solution, and I'm going to insert my medication. I'm going to go directly into the bag without, careful not to puncture it, and I'm going to administer my medication. Okay, this needle will go into the sharps bin. I'm going to rotate my medication to make sure that it's mixed thoroughly. And then I will label the medication bag with the name of the medication, which here it's Rocephin. It was 1,000 milligrams. I'm going to put the patient's name on it, and then I'm going to time and date it and also put my initials on it as well. I'm also going to label my tubing with my initials, the date, and the time. So I'm also going to, because I do have to perform an ASASH later, I'm also going to draw up my 6 milliliters of normal saline so that I'll be able to flush the line once I actually attach it to the patient's IV line. So here's my bottle of normal saline. I'm going to clean off the top. And again, I said that I'm going to drop 6 milliliters in a 10 milliliter syringe. Put in the air. Got that. I'm using the 1 scoop method. Clamp that, and it's ready to go as well. So now I'm going in to introduce myself to the patient and tell them all about the procedure, and here we go. Knock, knock, knock. Good morning, I'm Monique and I'm a nursing student. How are you today? You're doing good? Very good. Your doctor has ordered for you to have Rocephin inserted into your IV line. First off, can you identify yourself? Give me your name and date of birth. Kelly Jackson, 3/23/23. Okay, very nice to meet you, Kelly Jackson. So, have you ever had Rocephin? Okay, you haven't? Okay, do you have any allergies that you're aware of to penicillin or cephalosporin? No? Okay, yes, it does say in your chart that you do not have any allergies. And I just want to kind of look at your arm. Everything looks good. The IV site looks good already. Okay, and this medication is an antibiotic. And again, like I said, you would not be able to take it if you had any allergies to cephalosporin or penicillin. It is very strong and it can be kind of taxing on the veins, but I am going to be monitoring you very closely for any signs of redness or irritation or any phlebitis, because that's very important to make sure that the site stays clean and you don't have any signs of inflammation or infection, okay? So the first thing I would do, I have my bag of medication that's already been labeled outside the room, and I have my tubing. I would put on my gloves. And then I would bring out my tubing and attach it to my primary solution bag. So I would take the top off, as well as my tubing, and I would insert it in. And then I would hang my bag up here and squeeze the drip chamber till it's 1/3 to 1/2 full. And then I would prime my tubing line. So I would unclamp my tubing as well as my roller tubing until it's all the way prime, all the way to the end. So it's a little slow, but it's coming. So once it's all the way to the end, you can let that rest. Sit back here. I would then perform the ASASH on my port. Outside the room, I had already drawn up my 6 milliliters of solution. So, clean that off again. I'll connect my 6 milliliters, and then I would use the push-pause method. Oh, I would also aspirate first for any blood return. I'll clamp that, and I see that I got a little bit of blood return. And then I would push, pause, push, pause, push, pause. 3 milliliters of that solution. Very good. So my IV site, or my IV line, has already been primed. So again, I would take an alcohol swab and clean that off, as well as my INT port, and I would connect the two. And then I would unclamp my tubing and wait for the drip. I would look at my watch, and over a minute's time, I would make sure that the rate, which is 33 drops per minute that I calculated outside the room, would actually be consistent with what is in the drip chamber, and that it's actually dripping at 33 drops per minute. And if it's too fast, I would slow down the clamp, and if it's too slow, I would speed it up, just so that it's within the 33 drops per minute. So after all of this is correct, I would then document in the patient's chart how well they tolerated the insertion of the primary line. I would also document the time and the date, and then also the medication that I used. Also, anything about the IV site that I noticed that was out of compliance, any redness, any swelling, any infiltration, phlebitis that I noted. And then I would put the call button within the patient's reach. I would monitor any intake and output as necessary, and just have the patient call me if they have any issues, but also come back within 15 minutes just to make sure that it's infusing correctly, and if there's any adjustments or anything that needs to be made, or if there's any problems, I would make note of that. So this concludes my demonstration on how to do that. And then right before that, I could also flush my line one more time with the remaining 3 milliliters of solution. If I can get this off. Oh. And then reattach it. And if the patient has any, the doctor has ordered any heparin to be administered based on facility policy, I would also administer that. And that's just to make sure that if there's any clots in the tubing, I could break those up. The doctor has not ordered heparin in this case, so we don't need to use that. So this concludes my presentation on how to administer a primary line. Have a great day.